operations will be closed indefinitely. So we can focus on emergent response or until there's water where employees can come back to buildings. We are seeing some restoration of power. We are back down to about 90,000 people who are still without. It is with a very heavy heart that we announce we have confirmed 40 storm-related fatalities. And with that, I'll turn it back over to you, Stacy.
Thank you, Admiral. And now we have representatives from the city of Asheville here with us. And we'll start with Mayor Manroman.
Thank you. First, I want to thank everyone in our community who is volunteering in this relief effort. We can't do this without your help and assistance, and your partnership is amazing in helping all of the folks in our community, including your neighbors, those who are checking on their neighbors. Thank you. I also appreciate everyone adhering to the curfew that still remains in place. That curfew begins at 7:30 p.m. and is lifted at 7:30 a.m. each day. I want to thank all levels of government and other private and nonprofit organizations for their tremendous support. We have heard from our state government, our federal government, and organizations, companies, religious, faith-based institutions, everyone reaching out to us to help us. From the federal level down, the assistance and interagency support has been remarkable. President Biden called me personally yesterday evening to let me know he was providing whatever is needed for us. Particularly, he mentioned satellite support to help with our cellular communication challenges. Governor Cooper is here today. He has been in regular contact with me and with our organizations, facilitating the state support effort and relief effort. And we have leadership from multiple state agencies here as well and have been in continuous contact with us. On behalf of the city, I also want to thank the agencies who have provided emergency response and public safety assistance. We have approximately 260 fire and emergency search and rescue support personnel from agencies across the country. We have over 120 law enforcement officers from across the state in Asheville helping with emergency response and security needs. We have also received support from several local water utilities. Additional detail on utility support provided will come later in this briefing. We've received public works support from other agencies and contractors for critical needs ranging from debris management to road clearance. Duke Energy has worked seamlessly with our public works crew to work on road clearing and to assist with power restoration efforts. We've had great support from IT infrastructure partners from the private and public sector, helping with things like Wi-Fi and cellular hotspots and cybersecurity support. Support agencies include FEMA, Search and Rescue, U.S. Fire Administration, North Carolina Emergency Management, North Carolina National Guard, the Buncombe County Emergency Management, New York Incident Management Team, that's New York State Incident Management Team, North Carolina Incident Management Team as well. And Fire Chief Michael Case will provide more detail on the role of these agencies and the role they're playing. Last but certainly not least, we also consider our residents, businesses, churches, and nonprofits as key partners in this emergency response. We appreciate your support and concern. This recovery effort will take time. We want continued cooperation and concern over the coming weeks as we collectively work to rebuild our community. As I said before, I encourage you to check on your neighbors. I know that many of you are already doing this. I can't say enough how amazing it is to see everyone in our community jump into action and to help one another. And I want to personally say for our first responders, as well as the city and county personnel that are working around the clock, you're doing an amazing job. And I've seen it firsthand here at the county. We're at the county's ESC. There are rooms full of people working tirelessly. And today, down in front of Peck Square, city staff out there, who obviously normally have other jobs, are out there helping distribute water, and spending their time helping our community. So they're doing an incredible job, and I know folks are tired, but it's gonna be a long road ahead of us. So thank you all so much for your work.
Good afternoon. My name is Deborah Campbell, and I serve as the city manager at the city of Asheville. I want to also start my remarks by thanking the community for the amazing effort that is being given at this particular catastrophe. Just about is the right terminology for it. I know the lag in supplies and communication has been frustrating. Please know that our team and our partner agencies, which you heard a lot about, have been doing everything we can to get you these resources: portable water, food, fuel, other supplies. We appreciate and hope that you will be patient with us. We are glad that these supplies, though, are coming in on a much more steady and regular basis. So I want to give you just an update on a number of things that are occurring. I want to remind everyone to please continue to call 911 in case of an emergency. We are currently distributing water, as you have heard, from Peck Square, 70 Court Plaza until dark, or when the supply runs out. Each person is now being provided 2 gallons of water with a maximum of 5 gallons per family. Each person must bring their own container. For today, none will be provided. We are working to have containers available and will send updated information as soon as we have more information. And as with the county, to focus all of our resources on recovery efforts and to maximize safety, City of Asheville offices and parks will also be closed until further notice. Additionally, there will be no trash and recycling service in the City of Asheville until further notice. Bus service remains suspended while buses are involved in relief efforts. Cellular service: a temporary Verizon cellular satellite trailer is located at the Family Justice Center at 35 Woodfin Street. Additionally, T-Mobile has set up satellite cellular on trailers in Asheville at Asheville Middle School at 211 South French Broad Avenue and Dr. Wesley Grant Center at Southside Community Center at 285 Livingston Street. And with that, I will also echo the mayor's comments about, again, our community partners, thanking them, the nonprofits, everyone who has a hands-on, all hands on deck to address this issue.
Thank you, Ms. Campbell. Good afternoon, residents of Asheville and Buncombe County. My name is Ben Woody. I am one of the assistant city managers for the city of Asheville, and I am going to give the community an update on our municipal water system. Want to reiterate, as I said yesterday, the damage to Asheville water system is catastrophic. And I want to underscore that. We have a severely damaged water system. And so I'm going to give some details on what that looks like, but I'm also going to tell you a lot about what's happening. And before I start, I want to echo Ms. Campbell and Mayor Manheimer and just say how proud I am of our city employees. And I want to ensure the community that our water department and our public works department are working 24/7 every hour of daylight to restore water to this community. And so just to give a little bit of detail, Tropical Storm Helene, it washed out 24-inch and 36-inch water main lines, transmission lines at the North Fork Water Treatment Plant. Following the 2004 storms that had that same impact, the city installed bypass lines to create redundancies. Those two were washed out. These are the lines that deliver the majority of water to the city of Asheville, and they have to be replaced. I also want to note that we share water to our partners organizations and municipalities. We had an 8-inch line, at North Fork that also delivers water to Black Mountain. That too was washed out. Our water personnel have very limited access to our William DeBrule water plant at Beatree. That is due to the road washing out for that facility. We have the National Guard en route to assist our water staff with access to that facility. And I want to just take a minute to discuss information that came out last night regarding our Beatree Dam. Water staff and multiple outside agencies have been able to inspect that dam, by ground and air. And I want to assure the community that dam is functioning as it should, and there is no evidence that the structure has been compromised. And I also want to thank and show appreciation to our county partners that helped us dispel this rumor in this morning's press briefing. So thank you, Ms. Pender and the county. But I want to be clear that each plant in our system, we have 3 plants, and their production ability and distribution infrastructure require extensive repairs. But also I want to share that we have made great strides with our government and private sector partners. We have people helping us already on the scene that are beginning those repairs. They are underway. I actually want to express deep gratitude to some of our local contractors, T&K Utilities, TP Howard, and Tanoka Utilities, who are already helping us make repairs. And we appreciate their support, and they are all in with us on that. Also want to thank the city of Greensboro in particular. The city of Greensboro has sent us water personnel, crews, and equipment to begin making repairs to our distribution infrastructure. And the good news is there is more help to come, including help from NCDOT. Another thing I want to note is we also have a dedicated water incident management team. And Chief Case, you may be able to talk a little bit about that, but that is a team that specializes in disaster recovery, and they are dedicated to our water department efforts to restore these plants and distribution and infrastructure so they are functional again. We do have a plant that is operational, so there is some good news. The Mills River treatment plant is operating, but it is doing so at a very reduced capacity. We have equipment on the way that will assist in increasing that operational capacity, and we expect that equipment to arrive on Tuesday of this week. So we hope to begin to ramp up production capacity at Mills River this week. I just want to remind everybody again that Helene was a generational weather event. It caused historic destruction, not only to our water infrastructure, but it's also created historic logistical challenges with the delivery of materials that are absolutely necessary to make these repairs. But I will tell the community we already have materials arriving. They are coming already. We just need more, and we'll continue to get that. I can't provide a precise timeline as much as folks want me to do that. We are not able to do that. We are still accessing infrastructure that is buried under debris that is perhaps inaccessible because of water that still remains. We are doing that every day as fast as we can. But again, I want to note that restoring service to this system could potentially take weeks. As repairs progress, as we make progress, we will begin to see service return, but that's going to happen slowly, and it's going to happen in some areas before others. It's going to be based solely on the level of damage to the system and how we're able to make repairs. For those customers that do have water service, and some still do, a boil water advisory remains in effect. And again, that means you need to boil water rapidly or vigorously for at least 1 minute before you consume that water. Because potable water is limited and we do have distribution sites up and running, you should not use potable water to flush toilets. Please only use potable water for consumption. Find other non-potable sources of water to flush your toilets. Again, I just want to express my appreciation for our partners and our staff, and I am grateful for your patience while we dedicate every possible resource to reconstruct the damaged portions of our water system. And with that, I'll turn it over to Chief Case.
Good afternoon, everyone. My name is Michael Case. I serve as the fire chief for the city of Asheville. And I, like many of you, live in the city of Asheville in Buncombe County. And like many of you, I too have suffered from the effects of this devastating storm. My purpose here today is to give you some idea of some of the resources that we have brought into the city and what they can do for us. Additional details on these emergency services that have come in can show you how much we are looking into and how we are trying to speed up our recovery efforts. One of the largest assets we have coming in here from the federal government is the urban search and rescue teams. There are two assigned specifically to the city of Asheville. One is Arizona Task Force 1 out of Phoenix, Arizona. The other is New Jersey Task Force 1 out of McGuire Air Force Base, New Jersey. These teams are multifunctional teams and they provide specialized skills such as structural engineers, specialized rescue aspects to solve collapsed buildings, landslides, and water rescue work. They come with them with canine search capability. They have advanced medical treatment from ER physicians and are capable of doing minor surgery in the field. They also have hazardous materials response capabilities, and they can do swift water rescue in the most austere environments. Another aspect coming to us was given to us through the North Carolina Metro Fire Chiefs Association and the Office of State Fire Marshal. Last week, we called them and they were able to put together staffing for the entire Asheville Fire Department for 6 straight days to allow our weary firefighters to go home and take care of business at their home. Many of them are suffering from mental and physical strain, and the 6 days that they are given off is going to help them tremendously. Another aspect that has helped tremendously in the recovery efforts is from the North Carolina Army National Guard. They provided us with high-profile vehicles for fording deep water and evacuating survivors. The ability to get into these deeper areas speeds up the rescue efforts and recovery efforts. It also allows us to forge through high mud at the same time. They also have assisted us tremendously in clearing of roads. Finally, we are talking here about the incident management teams. These incident management teams are highly skilled individuals and they're responders with experiences in all types of disasters and emergencies. These skilled responders will help teach us the methods for aiding in our reimbursement, to speed our recovery efforts, and provide structure and deconflict conflicting priorities that we may have. Our current projects that these incident management teams are working on include developing pod distribution points for our water deliveries and to our citizens and our residents. They are also used right now to organize our water distribution system. One of our primary efforts, as Assistant City Manager Ben Woody said, is to put our water delivery system back in service, and they will help us organize that and speed those work efforts. I want to close out, however, with a thank you for the partnership we have with Buncombe County, the fire services there, the emergency management services there, and all the others that work both for the county and for the city, and how fast and how efficient we are working together. Thank you.
Good afternoon. My name is Jim McAllister. I'm the mayor of Woodfin, the first community adjacent to Asheville on the north side. Before I start with my brief comments, I want to say that since the storm, since the first sunrise, I have been absolutely blown away by the thousands of acts of kindness that our residents have shown each other in Woodfin. It's been a beautiful thing to watch. I'm also will be eternally grateful for the incredibly hard work of Woodfin Fire, Woodfin Police, and Woodfin Public Works, who have been working without showers, meals, or sleep since this storm. You have our sincere thanks. Woodfin experienced major devastation along the French Broad River. Both of our bridges are closed and are heavily damaged. We do not know if they will reopen. Silverline Plastics, our largest employer, has experienced devastating damage. The cofferdam being built for the wave construction is underwater. We fear it may be gone. We will not know for some time. Both of our town parks are still underwater. We cannot assess the damage. I can tell you some good news. All persons in Woodfin now have access to a road or street. We are not aware of anyone still blocked in by trees. Bad news is we had one fatality in Woodfin, a woman who perished from a falling tree. We still have no power within our town limits. There'll be no trash or recycling service until the town has access to fuel for our garbage trucks, and the Kirby Company experienced unbelievable devastation to their Woodfin plant. I've been asked by Woodfin Water to give a report on their service. This is from Gordon Mayberry, the chair of the Woodfin Water Trustees, at a 1 p.m. briefing he gave to our town. Woodfin Water is not functioning for 2 reasons. It cannot get its normal 25% supply from our partner at Asheville Water. It has also experienced a major break in its 12-mile source pipe from the reservoir. This pipe runs through heavy wooded areas and has been underground for decades. Duke and DOT, though, completed the process of clearing the path so that the search for that break can begin. The most likely source of that break is where that pipe crosses the many creeks and streams. And if we get lucky and find the break there or breaks there, that is something that the crews can fix themselves. The dam at the Woodfin Water Reservoir has been inspected and is in no danger of failing despite the many rumors that failing is imminent. There is no ETA for water resumption. I'd like to close by reminding everyone on this that's listening or watching this that many traffic signals in the area and county are out of service. When you approach one of those, remember driver's ed. The law says it is a four-way stop. I saw so many close calls today as I drove in the area. If you do not stop at an out light and you're involved in an accident, the law considers you to be at fault and your insurance company will not cover you. So please, everyone, you see a red light and it's out, please stop. Thank you very much.
Thank you. And before we get started with Mission HCA, I have an update from the town of Weaverville. They were unable to make it today, so they provided this information for this briefing. Residents of Weaverville can expect water distribution today at North Windy Ridge. All water sources like lakes, rivers, and streams should be treated as contaminated. Do not consume at risk of illness. Some water services will be restored this week if and when it is restored. A boil water advisory will be in effect until further notice. If self-evacuation is encouraged, I-26 East is open, I-26 West is closed, I-40 in both directions is closed. Bear Closet at the Methodist Church Fellowship Hall on Main Street has baby supplies. Their hours are posted on the door. Prescription Pad on Main Street at Merriman is filling emergency prescriptions at the drive-thru. All available contingency plans have been enacted. All water conservation efforts are encouraged. Curfew is in place 7:30 p.m. to 7:30 a.m. If you need a police officer, call dispatch at 828-250-6670. Emergencies should continue to call 911, and walk-ups are welcome at the police department. And with that, we will turn it over to Greg Lowe, President of Mission HCA North Carolina Division. Greg?
Thank you. I want to first thank everyone with the efforts throughout our entire Western North Carolina region. So thank you for those updates. I'd also like to thank the many team members and caregivers who have been on site working in all of our hospitals in challenging conditions since Wednesday. Their dedication to our patients is inspiring. Our hearts are with the community as we continue to deal with the devastating effects of Hurricane Helene. Though the level of destruction is immense, our Mission Health colleagues have remained steadfast in support for our patients, our community, and one another. Next, I want to provide an operational update. Mission Hospital has been acting under what started as a storm planning since last Wednesday, but as the situation around us has evolved, we have moved into crisis protocol. Our key priority is to keep all health services open. Mission Hospital currently has more than 700 patients. More than 250 patients have been admitted to the hospital. We have delivered nearly 30 newborn babies. We have had 900 ER visits, with more than 200 of those individuals being admitted to our hospital. More than 80 patients needing admission into our hospital are currently being held in the ER right now. We ask staff to come into shift before they're started on Thursday evening and sleep on site in order to be safe and available to care for our patients. This meant that in addition to the more than 700 patients, we've had more than 1,200 local staff who are being paid to sleep here in the hospital between their shifts. Currently, our most significant priority is city water and sewer. HCA Healthcare has supplied more than 20 tanker trucks daily so that we can maintain clinical operations of the hospital. However, without pressurized water, we are significantly challenged with running many hospital functions, such as hot food preparation, toileting, and showers for those who are staying on site. To say that our teams are making the best of a rough circumstances in order to keep caring for patients is an understatement. I just met with Governor Roy Cooper, FEMA Administrator Deanne Criswell, and the North Carolina DHHS Secretary Cody Kinsley. We expressed the critical need for these resources. We have leveraged the scale of HCA Healthcare, who are providing increased assistance each day, delivering resources such as food, water, facility generators, satellite data networks, and critical medical supplies. More than 60,000 meals, hundreds of thousands of bottles of water, 28,000 gallons of fuel, 55,000 gallons of generator diesel, and 65 pallets of additional supplies. In the coming days, we will receive an additional 10 mobile units, including kitchens, bathrooms, hand washing stations, and mobile laundry facilities. We have HCA Healthcare colleagues from around the country continuing to arrive to provide support. This includes HCA Healthcare's incident support team, nurses, physicians, clinical and security staff from sister HCA facility hospitals. Yesterday, 2 busloads of nurses arrived from Nashville, South Carolina, and Texas, and they've been onboarded to support our patient care teams in the hospital today. HCA Healthcare is also evaluating how to best provide financial support to help address our region's near-term and long-term challenges related to the storm. We will be making an announcement soon of details regarding HCA's commitment of $1 million to local organizations. Thank you first to all of our colleagues, medical staff, EMS providers, and the countless others who help to continue to care for Western North Carolina. Thank you.
Thank you. And with that, we will open it up to questions from our media partners who are on the call. You can either unmute yourself or type your question into the chat.
Hi, it's Laura Lee at BPR, Blue Ridge Public Radio. I'm wondering about on the water situation. We have these sites that opened up, but the mobile distribution piece, we're hearing from a lot of people who are not able to get to those sites. Where are we on that part of the process?
Sure. This is Deborah Campbell. We are working through that this evening. We will personally, when I say personally, staff will be delivering to some communities, and we're getting ready to open up some additional distribution sites throughout the city of Asheville. That will happen within the next 24 hours.
Okay, and then I guess,
Go ahead, Laura.
I guess a more sort of big picture question. You know, we keep hearing in the briefings about cooperation between different levels of government, and then at the same time, you know, we're getting inundated with people telling us about the delays that they see and the lack of coordination between some of these organizations. Can you all speak to that? I guess in simpler terms, as my dad would say, like, what is the hitch in the giddy up here that if we have all this cooperation, like why are people not getting the food and the water that they need?
So Lauren, I'll start and anyone else can respond, but we've been consistently telling you that getting here, transportation was an issue. So it's not that the levels of government are not cooperating. It has been because of that cooperation that we were able to get to this point. I do know that we shared with you that I-26 was closed and coming up on Old Fort Road and 40 was closed. It's because of the cooperation with NCDOT and State Highway Patrol that we've gotten those open. Right now, the State Highway Patrol is still has 40 closed. It has 1 lane open and they're bringing people up and escorting people up. So when we say cooperation, that's what we're talking about. They have been working to help us to get resources. Now, I would freely admit that we were frustrated because it has taken so long to get resources. We were expecting them to be flying them in because the roads were closed. So that's the piece you're hearing about, the frustration and the hitch and the giddy up, as you say. But that's what we were frustrated about because it has taken us so long. to get them to realize that we were isolated and we need more than just road transportation. We need air support as well. So we had to prove that point, but once we've gotten there, we are seeing the resources starting to come. And that's what we're saying, that we are grateful to our partners because of those partners that we are where we are today. And I'll ask anyone to jump in there if anyone wants to say.
Can I just ask the follow-up, what kind of response were you getting from state and federal? You're saying that there was a reticence to use air travel to bring that in. What are you saying, that officials at the state level or at the federal level said, we want to come in by road?
No, as you recall, I think you would know that Thursday it was rain and wind, and then even Friday we had lots of wind. So when we were pushing to get them to start flying, they couldn't fly, and we were pushing to say, you need to get here, you need to get here. And we knew that our residents needed it, but there's also that safety factor. So they would not fly, I guess, and we started seeing flights coming in that Sunday, really, versus that's when it was really safe to come. But we were pushing way before then. Is there any way you can get closer? Is there any way you can fly maybe to Hickory or something else? And let's figure it out from there. But it truly was, you can't get here. The wind was too strong, and you kept hearing that back, and we were pushing as hard as we can to get resources here.
Hey, this is Will Hoffman with the Asheville Citizen Times. Avril, this morning, it sounded like you were going to be distributing food at the 4 distribution sites. Was this, this gap in transportation also affecting your ability to get food for the distribution sites? Or is it choice to just distribute water today?
We did have some MRE, and that was the food we were talking about. There are some MRE packages that was also available and was at some of the sites. I cannot speak for all the sites here, but I will confirm. But yes, there were MRE packages along with water that was at some of the sites. I can't say all of them for sure, but
There's no food at any of the sites yet.
So we do have MREs, and we would have those at the sites. We do need, and I'll make a plea now for anyone that has a box truck and a driver. We were asking for that. We have 4 box trucks, and those 4 box trucks have been delivering that water first, and we would add MREs once we get that. But if there's anybody out there that is listening that has box trucks that can take palletized water, that can help us to move that and add those MREs to that, that would be most helpful. If you're interested in helping us to drive, please call our number at you have a number.
I can get that number for you, but email Helene volunteer.
Can be more efficient in delivering that water as well as delivering the MREs to our residents.
It's Laura again. I have a question for the city. We understand that the water that was distributed today in the city was privately purchased. I wondered if you could confirm that, and if so, why it had to be privately purchased as opposed to coming from a state or federal authority.
We think that we always have to have a plan A and a plan B. And as the delay in the water delivery from another governmental entity, it can impact it. Our comfort level, and I think obviously the impact on the community, we took a proactive action and purchased it. But I'm thinking again, we were being extremely proactive about having a backup plan. Since it was not delivered at the time that we thought it was going to be delivered, we had to take action to support this community.
And what was the other agency that didn't get it there on time?
State
Emergency Management. Because of all of the obstacles and issues that Avril just explained to you.
Hi, this is Jeff Tammer of the Charlotte Observer. I've been seeing the NC National Guard has been tweeting about evacuating people by air from Avery County to Hickory, North Carolina. I know there was some talk this morning about potentially looking into evacuation and finding places for people to go. Has there been any contact with NC National Guard about that, or any discussions about evacuating residents from Buncombe County?
I can speak towards we have been asked as the Asheville Fire Department to provide landing zones for various helicopters that have been evacuating patients from the hospital. That has occurred a couple different times, and our companies have been available to do that. It is not happening on a widespread basis, and it is for patients that need more advanced level care.
I guess I'm wondering, is there any chance that if the NC National Guard offered evacuating residents from Buncombe County and taking them to wherever you might be able to take them to, would that be something that you're open to, or are you reserving it for specifically local emergency services?
I don't know if we understand the question.
The people
I can
are
read. Oh, sorry, go ahead.
People are and can leave Asheville if they choose to do so. The interstate to the south is open, and they can leave if they choose to do so. So I don't know that using.
But if they don't have if they don't have transportation, how would they evacuate?
We have not organized buses or anything, to your point, to do evacuations. We would need to reach out and see if that's a need. We haven't heard that as a widespread need. So if you have some information that we're not aware of, please share that. And we would actually do some planning around that. As Deborah mentioned, we're talking, we're planning. And if that is a need, we're not aware of that as a need right now.
I would echo that from the town of Woodpin. We've had no request from residents for evacuation assistance.
Hi there. This is Tiffany Alaniz from KSNF TV and Nexstar News. Just wondered if there is a Black Mountain update at all as far as the situation there, food and water, and also any possibility of shelters there. And then also, I know that you all had mentioned this morning that the shelters even in Asheville and the surrounding areas are full. So just didn't know if there was a plan now that with FEMA on the ground to get a larger scale shelter open, possibly at one of the universities or such. And again, thank you all for having these updates.
What we've heard from Black Mountain is that water system still remains compromised. I don't have any further update from that. We are looking at a fourth shelter in Asheville, and we're working on the logistics of that with the FEMA partners, but mostly with their Red Cross partners as well. Once that is up and running again, without power and without water, we need to bring those facilities there first before we can wrap up a fourth shelter. The AV Tech Conference Center still has some capacity, and that is not full at this point, as far as I'm aware. So we still have some capacity if someone needs immediate shelter, but we are working on that other side with our partners from Red Cross and FEMA.
Specifically with FEMA, just one follow-up question. I know I just saw within the last few hours that the president has directed FEMA's director to stay in North Carolina until the situation is more stable. Big picture, what are the first things that you all need for them to do as far as setting up or that you may have already communicated with them as far as big picture things that need to happen now?
The things that we would need that FEMA would typically provide for us would be facilities as restrooms and shower facilities. And then those are the major twos, and large scale generators that can power those sites. So those facilities those are the things that we would need to have in place before we can open the shelter. And the next would be cots available, and those typically come from FEMA via the Red Cross. So those are the four things that we would need from FEMA to get a site open.
Another very important thing that FEMA can do for us is they will be on the ground. I don't know exactly when, but in the next few weeks, they need to do their own disaster assessments so they can find out the extent of the damages and put some financial numbers to see how much the damage has been done in the region. So they are a major partner in that assessment process. They will do that with county and city officials when they tour the areas to see how much of the impacts have been on us.
Thank you very much. One final question. Do you all know, and I know that this is fluid because obviously there are areas that people do not have a way to contact or get any word out, but I know at some point yesterday, the number unaccounted for was still around 500. Have you all been able to get any update from the Red Cross? I know some of them were working on the list, and I also know Buncombe County was working on your own list as far as the number of people still unaccounted for. Thank you.
I do not have an update at this time on unaccounted numbers.
And we don't have an exact number on city residents as of yet, to my knowledge, but we will hopefully have that information in short order.
Okay, thank you. Thank you all again for the updates.
On those things that you said from, sorry, it's Laura again, those things that you said from FEMA that you needed, the large generators, the showers, the toilets, have FEMA officials given you an indication of that they would provide those, and if so, what time frame have they offered that at all?
I don't have a time frame for the new shelter, but they have provided those for the existing shelter, so I have no reason to believe that they wouldn't continue to do so.
There's a question in the chat. How much did the city of Asheville spend on the water now available at Pack Square? Is there a plan or expectation to supplement that supply in the coming days with further purchases, or is a supply from state and federal partners expected to supplement that?
We are expecting federal and state to supplement that. Again, this was almost like an emergency purchase, and it was in the hundreds of thousands.
Are there any additional questions?
Yeah, I have two more. Given the restriction, the lack of water that hinders people's ability to, wash their hands, cooking measures, things like that, are there growing public health concerns about the implications of not having water for those purposes?
At this time, our public health nurses have not shared that, so I know that people have lots of sanitizers still available from before the last time we were in this AOC. But no, I haven't heard that from public health at this point.
And Laura, we are working to bring public health subject matter experts into these briefings moving forward, in particular environmental health, as restaurants look to reopen, how to do so safely, and also what to do when your food, is no longer, cold. So we will be bringing those public health experts into these briefings periodically.
And just one question, sorry, that I saw on Facebook as well. I know you guys had asked for box trucks and such. I see some people asking where they should contact if they do have a box truck or something like that. Who should they notify?
They should email Helene donations at buncombecounty.org. And I will put that into the chat as well.
My last question was for Greg. It was about HCA, and given some of the tension that you've had with between management and nursing staff. I know you said you're bringing in some nurses from other places. Do you have a sufficient level of nurses? Is there an intention to bring more nurses in to alleviate the current staff?
The current efforts of our caregivers is absolutely heroic. The conditions that they're working in and the care is providing, it's safe. The care that's been provided is great. We are handling the patients, but as I mentioned earlier, we have an influx of patients into the emergency department that is putting stress on our system, undue stress, when we don't have municipal water, city water, and for quite some time we didn't have power, so we were running on generator power. So we are adding those nurses to supplement, to allow our nurses that have been on site, and not just nurses, it's all of our caregivers. Everyone has been on site since Thursday. A number of our individuals, our caregivers, have no idea about their families or their homes. We have not contacted a number of our colleagues. We have had no contact because of communication disruption. And so what we've done is bring in hundreds of individuals to assist in that, provide relief for those caregivers so that they can go home, check on their families, and then return to care for Western North Carolina.
Are there any additional questions? Oh, here's, is there any supply of ice on the way, or is that a concern for the upkeep of food and medications?
We are working with a supply of ice. We're working with some providers on the eastern part of the state to bring us some ice. So we will work on that and we'll get some updates on how quickly they can get here.
I apologize if you guys covered this at the beginning. I know that you all said that the FEMA supplies are kind of hitting the ground running today, and that you all mentioned that you guys purchased the water for today, obviously. Is there an idea of when their water will be functional, and have they brought in additional water? Because I know there was a concern this morning that maybe it wasn't enough, at least immediately. Thank you.
We don't have an ETA when we'll get more water. We don't have an ETA of when we'll get more water. We have been told that it's on the way. And so we are expecting that now that we've opened our shelters, our water distributions, that there will be water consistently coming, but we don't know exactly when that is. To Deborah's point, the plan B was to purchase water to make sure we can supplement and get water to our residents. We've done the same, and we're working through making sure that we have a plan A and plan B to make sure our residents have water.
Okay, yes, and obviously I totally understand that. So am I to understand correctly that the loads that FEMA brought in are not operational at this point?
They are operational at the county sites. That's what the county's been giving out, and we have water. Well, whatever we receive, it will be split between city and county. The city is currently using a private provider. But when that's out, they would be using some of the FEMA water that has been done as well. So there is water that we still have that is coming in. And what we've deployed at the county sites is the FEMA water that was brought in.
Okay, thank you for the correction. I appreciate it.
Okay. Are there any additional questions? Okay, great. Well, thank you so much for attending the 4 p.m. briefing. We'll be back tomorrow at 10 a.m. on Facebook at Buncombe Gov. Thank you.